10 minutes past 7 indeed. So it's something that will affect 4 out of 5 people at some point in their lives. It's back pain, and it accounts for an estimated 5 million sick days each year. Doctors are now being given new guidance on how to tackle it.
At the moment, it's a bit of a postcode lottery as to how you're treated, but the British Pain Society wants sufferers to go back to their GPs after a fortnight if initial treatment hasn't worked, and for doctors to refer patients to hospital then if there's no improvement after 12 weeks.
Is enough, though, being done to prevent people developing back pain in the first place? With us, Chris Sweetnam, who's been living with severe back pain for the last 25 years, and Kate Grady is from the Royal College of Anaesthetists and a pain management consultant at the University Hospital of South Manchester. Very good morning to you both.
Good morning.
Good morning.
What is it like living with back pain for 25 years? How bad is it, Chris?
Well, it devastates one's life. You know, from being an active individual who used to hill walk, rock climb, medium distance running, Bill, to somebody who actually is really stuck in can be stuck in a chair, 10 minutes. I have to stand, standing 10 minutes. I have to lay down, unable to walk more than 5 or 10 minutes. Sometimes, unable to sort of get out of bed in the morning.
And how did you do the damage to your back in the first place?
Well, I, being pretty fit, I thought I could tackle anything, and there was an airport strike back in 1987. Carried heavy suitcases, fair distance. A day later, I had prolapse of 2 discs of the lumbar spine.
That was it.
Yeah.
So carrying heavy suitcases on one airport trip has left you with a legacy of more than 2 decades of pain.
That's right. Yes.
Awful. And Kate, new guidelines then for doctors to deal with back pain. How might that change things for patients like Chris?
Well, today is the launch of a pathway,
Right.
and it's launched in the British Journal of Anaesthesia, and as you've said, it's a British Pain Society pathway for the management of low back pain. And where this is different to what has gone before in terms of guidance in the management of back pain is that this guidance is for patients, patients' carers, patients' relatives, as well as healthcare professionals. And the pathway is quite specific. It's available to patients on the internet. It's a collaboration between patient and healthcare professional, and there are very clear steps, clear timescales, and clear guidance as to what to do, where to go if time targets aren't
as you say,
achieved.
clear timetable. Go back to your GP if it doesn't
Within
improve
the
in
2
2
weeks
weeks,
that
and
you've
then
alluded
take
to,
further
yeah.
action in 3 months. In other words,
Yeah.
not let the problem slip. Do you think that's, would that have made a difference in your case? Do you think?
Indeed. I think this is excellent, the pathway. I mean, in my day, one was prescribed bed rest for 2 months, and of course that's the worst thing one can do. The muscles waste, and the condition worsens, and the chance of developing the chronic pain increases. But now, with the pathway and with access for individuals to actually know where they're going to go and to have clear timescales, it's excellent. I think the only thing that would concern me is, there are excellent professionals working within the service who have developed the pathway, but individuals, they're faced with cuts in the health service, waiting times to see various consultants, and this is putting pressure on the service.
Kate, has anything changed in terms of the treatment of back pain? Does this new set of guidelines about a pathway reflect a different approach?
Well, it reflects a different approach and an early approach. So the initial encounter with a healthcare professional would be a stage at which reactivation would be advised, as Chris has mentioned.
Reactivation meaning?
Meaning getting into activity as opposed to taking to one's bed and a prolonged period of bed rest. But alongside that has to go patient education, so that the patients know it's okay to be active and that they're not doing themselves any harm. And then alongside that, there may be the need for some medication to get them through those 2 weeks of being active.
Chris, you've had a couple of operations.
That's right.
What sort of treatment are you on now? Is it?
Yes, I'm with the pain management clinic. I've been with them for a number of years now, and you know I have cognitive behavioural therapy, injections into the muscles surrounding the spine to reduce inflammation. That's about the extent that
Just managing it rather than making it better.
That's right. Yes, I mean it's a question of managing the situation now.
And Kate, do you think that these new guidance, this new pathway for patients, will see people recover quicker from back pain or manage their pain better?
Well, it will see them not develop the same level of chronicity and disability has happened in the past. And
So fewer people are experiencing what Chris is experiencing?
Yes, that's right.
That's
and
right.
So it's an end-to-end pathway, effectively, where at the end there's a very much more manageable problem.
All right.
Yeah.
Okay, thanks very much, Chris. Wish you all the best with your work.
Thank you very much indeed.
Thank you both very much.
16 minutes past 7. Coming up later on the programme, the NHS is reaching boiling point, we're told. It's a stark warning from the British Medical Association. Its leader will explain why doctors are feeling disillusioned and improvements that they're offering are being hindered by red tape.